Some Republican reaction to what we just heard from the President of the United States. Representative Greg Walden of Oregon is joining us right now. He's the chairman of the National Republican Congressional Committee. Congressman, what do you think of the President's remarks?
Well, I thought it's very intriguing in that his budget really lays out kind of a shocking attack on seniors, if you will. And we haven't seen all the detail yet, so we'll look at it. But I'll tell you, when you're going after seniors the way he's already done on Obamacare, taking $700 billion out of Medicare to put into Obamacare, and now coming back at seniors again, I think you're crossing that line very quickly here in terms of denying access to seniors for health care in districts like mine, certainly, and around the country. I think he's going to have a lot of pushback from some of the major senior organizations on this and Republicans as well. And this is a budget that doesn't balance. At the end of the day, you can have all the flowery rhetoric, but I'm a numbers guy, and this doesn't add up. It does not balance. We've passed the Ryan budget. It does balance in 10 years. It will put us on a path to grow the economy and jobs. And again, it gets us to where we have a balanced budget. This is 65 days late, and it doesn't add up.
Well, let's talk about these proposed changes that the President is putting forward when it comes to Social Security and Medicare, the shocking proposals that you say the President is putting forward that could affect seniors. What's so shocking about changing that CPI, that Consumer Price Index, the way that you would determine how much inflation would go ahead with increases for Social Security recipients, for example?
Well, once again, you're trying to balance this budget on the backs of seniors, and I just think it's not the right way to go. And I think
doesn't Paul Ryan's budget have major changes as far as Social Security and Medicare are concerned as well?
Look, it doesn't do, yes, but it doesn't do that. And so I just think there's some, you know, it's all about when you get to the specifics. And what does that really mean down on the ground? You know, the President just said that his proposals will reduce the cost of health care. Where did we hear that before? We heard that premiums for a family for health insurance would go down $2,500 if his plan was adopted, and we now see them going up $2,000 in my state to $3,000. So you got to cut through the rhetoric, Wolfus, which of course you all and your team will do, and get into the real facts and figures, and so will we. But I don't see this budget as either on time, adding up, balancing, and further, I think it really does go right at seniors in a way they're going to be shocked coming out of this administration.